One of the most common questions running experts get asked is what running shoes help with plantar fasciitis. Believe it or not, it's multifactorial in its answer. It's not that simple, and it really depends on the patient and types of shoes that they're wearing. So let's get into this very important topic. So plantar fasciitis, as many of us know, is a very, very common running injury. In fact, a lot of runners are using shoes that worsen their symptoms of plantar fasciitis and don't even know it. And there's several misconceptions that are out there when it comes to plantar fasciitis. A lot of runners will talk about how they need extremely high arches in their running shoes, or they need very cushioned running shoes, or even that they need to run on their toes to be able to prevent or lessen the symptoms of plantar fasciitis. All of these might have a shred of truth for certain patients or certain runners, but there's a lot of falsehoods here. So I want to clear the air and I want to talk about plantar fasciitis and how it correlates to shoes to give a little more detail. Let's talk about some of the considerations when we're recommending shoes and some of the things that we definitely want to avoid and some of the places that maybe more research is needed. Before we get too far into this topic though, let's talk about plantar fasciitis and what is the mechanism of injury while running. Well, plantar fasciitis is caused by micro tears in the plantar fascia. And those micro tears are occurring because of overstretching. Now, while plantar fasciitis is actually due to many different factors, one of the important things to think about are the risk factors. And that is, plantar fasciitis can come from either having very high arches, very low arches, maybe a reduction in dorsiflexion range of motion, or reduction in functional muscle length in the gastrocnemius or soleus, or it can come from limited inversion or eversion. Another thing you'll commonly hear about plantar fasciitis is that it can be caused by heel spurs. And what the new research and even some of the older research are in agreement about is that heel spurs, while they can aggravate symptoms of plantar fasciitis, they are rarely the cause. So again, we want to look at those risk factors as potential causes for plantar fasciitis. Now, while running, plantar fasciitis symptoms can worsen due to several factors. The impact of the runner landing on the ground is a big factor here. But also remember, at the end of the stride, the runner gets to their terminal stance and their toe off. And that pressure placed on the plantar fascia is also another factor that can aggravate symptoms or can create some of the symptoms of plantar fasciitis. So, what are the important considerations here? Well, obviously, when we're talking about plantar fasciitis, we want to think about shoes. We want to think about how it's correlated to the runner and what the shoe the runner needs. So there isn't a perfect shoe for everyone. There isn't a perfect running form for everyone. It's important to remember that when it comes to plantar fasciitis, because what shoe might work for one individual might hurt another. So when we think about those aggravating factors, one example is plantar fasciitis can develop or it can be worsened by just having an overly high arch in the shoe. So an external pressure or an external force being pressed up into that arch can cause a lot of pain and can aggravate plantar fasciitis. The other thing that can happen, creating plantar fasciitis, as we talked about before, is an unsupported arch or an unsupported foot. So for example, someone might have a nice heel strike pattern. They might have a very high arch that collapses and they just don't have the arch support. They don't have the support they need to be able to hold that arch up. So again, there's two factors here that are causing plantar fasciitis primarily. One is the arch collapsing from the ground reaction forces. The other is an external pressure or an external force being placed up into the plantar fascia. So let's talk about how running shoes can hurt plantar fasciitis. Running shoes can hurt plantar fasciitis a little bit dovetailing off the conversation we just had. So plantar fasciitis can occur, as we talked about, overstretching or from an external force. However, some athletes look for very supportive shoes with a very high arch support. And as we talked about, that high arch support can put a lot of pressure up into the plantar fascia, especially if you or the runner has a very low arch to start with. However, other individuals or other athletes might look for shoes that are minimal. minimally supportive, maybe they don't have a lot of heel drop, maybe they also don't have a lot of cushion. So that lack of support also can be responsible for some plantar fasciitis. That's the overstretching. It's unsupported. The foot is just being aggravated. Those micro tears are occurring. So other things that we'd want to think about is what other shoes might be causing a factor here. Well, high cushion we talked about, zero drop we talked about, but also the rocker soles. Some of those soles have a rocker to them, and so they are more rounded at the bottom, and that shape can potentially cause some aggravating symptoms. So I want to talk about how these shoes can hurt, and then I want to go on to how some shoes can help. But again, when we talk about the shoes that hurt, it's finding the right shoe for the right individual. That overly high arch, that overly supportive shoe can be more aggravating to a patient with plantar fasciitis because it unfortunately is too much support, it's too much pressure, and it's putting the pressure in the wrong place. However, another good important thing to think about is those patients that are running with minimal shoes. Again, they're just not supported enough. However, no matter what's going on with the patient's shoe, we again don't want to forget about the intrinsic risk factors patients might have. We talked about having a limitation in their dorsiflexion. Again, that limitation in dorsiflexion is going to cause more pressure to go through the plantar fascia and through the foot and potentially create more symptoms. And then also, if they're having maybe excessive external rotation, forefoot external rotation, or a foot progression angle, they are then rotating over that plantar fascia more than they would be in other shoes. So again, all those things would be an aggravating factor that could potentially hurt plantar fasciitis. But let's get on to some of the fun stuff. How can shoes help plantar fasciitis? Well, a couple things to note here. Footwear, some clinicians do not like to change footwear at all for runners. They say, hey, this is your preference in footwear. This is what you've been using. Keep using it. I personally would say that changing footwear is something to not consider loosely. If you can avoid changing the footwear, don't do it. Don't change it. If they don't need a change, don't just give them a change to give them a change. However, if the footwear is causing symptoms, we definitely want to change it to limit those symptoms or resolve those symptoms. Now, some of the biggest, newest changes in the research is that footwear is starting to trend towards a more moderate neutral shoe. We are getting away from those high cushion shoes because the high cushion shoes create more impact through the lower extremities. That includes the plantar fascia. And we're getting away from some of those very minimal shoes because they just don't provide as much support. Additionally, with the highly supportive shoes, again, we're trying to get away from some of these really, really supportive shoes because it's just too much bracing against the foot itself. The foot isn't able to use its natural biomechanics that were initially designed for us to be able to run, walk, and do all the things in everyday life. So how can certain shoes help plantar fasciitis? We want to think about that patient first. But one of the biggest things that they're talking about recently is having a stiff midsole. So you have the midsole of the shoe. You want that stiffness to be there because that's going to help to support the foot. Some of that help in supporting the foot is acting like a stability factor. It's not going to put as much pressure onto that plantar fascia, especially for some of those patients that have some forefoot external rotation. It's going to be a really good way to limit how much translation of that motion is happening. Additionally, we would also say that experts agree that those moderate cushion shoes are going to be helpful as well because the high cushion shoes create more impact and the minimal cushion shoes unfortunately sustain too much impact. They just receive too much of that pressure from the ground. So those moderately supportive shoes, cushion shoes are going to help a lot to be able to not give too much travel, too much overstretching of that plantar fascia. And it's really well documented to show the right height of a shoe or an insole to go along with the right height of the patient or runner's arch. And let's talk about this for a moment. I can tell you that I've seen countless patients that have the wrong arch height. They are a low or moderate arch and they're coming in with an Asics gel Kayano that has a really high arch, very supportive, is putting pressure up through their plantar fascia. Additionally, those patients that have a very high arch might need that gel Kayano, that Asics gel Kayano, to be able to support that very high arch. However, if the high arch is getting supported with a high arch in the shoe or insole, great, that works well. But again, if you're a low arch with a high insole or shoe, high arch in your shoe, it's going to be painful. It's going to create symptoms. Another thing to think about, again, as we talked about a little bit earlier, is making sure you have the right cushion. I'm not saying moderate cushion is perfect for everyone. Some people might need a little more cushion, some people might need a little less, but we're using this more Goldilocks method now. We're not going overly cushiony, we're not going very minimal. We're trying to stay in the middle. And then lastly, what we're really recommending for patients with plantar fasciitis, kind of a conclusion here, is that we want to give high midsole rigidity, some moderate cushion, and then the arch support that correlates with the arch shape of the patient's foot. So what do we look for with patients for plantar fasciitis? What do they look for in a shoe? I'm going to be a broken record here, so you're going to get annoyed. What we're looking for is to pair the right shoe with the right patient's foot and running style. Biomechanics, all those things should be integrated. This is where your clinical reasoning comes in. You're going to look at a patient and say, okay, they run, they have some overpronation, they have some external forefoot or a higher foot progression angle. They also have some valgus collapse of the knee and some pelvic drop. You may not want to give that patient a ton of support under their plantar fascia because while it is collapsing a little bit, it is not so high or it's going to press against that collapsing arch. You maybe want to give a moderate support or a minimal support. The other thing you want to think about is how rigid is that that shoe? How supportive is that shoe? How much cushion, how much heel cup support does it have? And there's a lot of differences. So there's some good examples we can think of. Let's think about our first runner here, runner number 1. A heel striker, forefoot external rotation bilaterally, excessive arch height with collapse. What do we want to give them? Some footwear choices are going to be high arch support, deep heel cup, high cushion, and high cushion and sole rigidity. The reason we want to give, we're not going to do high cushion. We're going to say high sole rigidity. Now, the reason we're giving this patient this shoe is because we want to give them nice support under the arch. We want to make sure it's collapsing, but not collapsing too much, so either high or moderately high arch support, depending on what maybe feels better for them. There's always shades of gray. And then we also want to help the prevent the runner from collapsing those arches so that overstretching doesn't occur. That sole rigidity is also going to help to prevent that rolling inward, or that overpronation is also going to help stabilize the shoe as well. Let's talk about runner number 2. So this is a midfoot striker, and they have a low arch height. So that low arch height midfoot striker, we also see genivalgum, hip drop, ankle instability, and excessive ligamentous laxity. All those things are an important factor. They have a lot of motion here. They have a lot of potential for overstretching. And the genivalgum and also the hip drop is going to go over the plantar fascia. That's going to put weight over the plantar fascia and create more symptoms. So what's the clinical reasoning here? What we're going to do is we're going to give them a low to moderate arch support to help give them a little support under their arch, but also make sure that it's not overly supportive. And then we want to make sure that we're giving them, again, that high sole rigidity. Make sure that it's going to support their ankle instability and ligamentous laxity. And let's talk about our last runner here. A heel striker, moderate arch height, without collapse, no presence of genivalgum or hip drop. Let's give them a neutral shoe. Moderate arch support, moderate cushion, and high rigidity in the midsole. The reason why is because we want to stabilize that ankle. We don't want to let them roll over. And for this patient, we want to make sure that their arch doesn't collapse while they're running. So we want to make sure that it's not going to aggravate that plantar fasciitis. Now, there's tons of different patients out there and tons of different examples of different shoes to give patients and runners. Obviously, there's tons of resources for you. You can attend some of our webinars or take a look at some of our continuing education, examining runners and going through with experts and analyzing the slow motion gait analysis. And you can also look up our course, The Essentials of Running Gait Analysis too, which gives you a really good idea of how to prescribe footwear as well. Until next time, stay safe, and we'll talk to you soon.